Good evening, everyone. How are we doing this evening? I know we're tired, but HOSA, I know we can do better. How are we doing this evening? We hope you've been enjoying the conference thus far, learning a lot, and making many new connections. We would like to welcome you to our Monday dinner session. Tonight we'll be hearing from the HOSA Service Project, Be the Match, and receive tips to effectively advocate and support the cause.
Tonight, we have a special guest from Be the Match here to share her story. Taylor Brown is the Donor Operations Specialist with Be the Match. Her story and mission are inspiring and enlightening. Please welcome to the stage Taylor Brown from Be the Match.
Hello, everyone. Like she said, my name is Taylor. I work with Be the Match. I am a donor operations specialist, and I'll tell you a bit more about my job in a bit. I am also a transplant recipient, so all of the work that you guys do, I wouldn't be here today without people like you. So first of all, thank you. So, thank you for spreading the word, for fundraising, for listening to my story, for having donors join, for educating them and getting them prepared to help people. I want you to keep in mind the role that you guys all do in saving people's lives, because maybe when you're on the ground, you don't really get to see what this vision does, but that's why I'm sharing my story with you today, so you understand the life-saving work that you do. I've included some medical pictures, so I know you guys are all medically interested. I do want to warn you, though, if you do get queasy, there's not anything that gross, but I know you're eating, so just wanted to give you a quick warning. Okay. So before I was diagnosed, I was a normal kid, just like you guys. I was basically, at this point, a junior studying biomedical engineering at Arizona State University. I had a grant from NASA. They basically paid me to do research, which was amazing. I was just a normal kid. I had just turned 21, so a lot of my friends were going to bars and getting a different kind of independence. So this is kind of the preclinical stage of cancer. Basically, there's a time before cancer, and maybe it's growing in your body and you just don't know about it yet. Preclinical basically means you're unaware. And I was pretty unaware. I was tired a lot, but I thought, this was just the life of being a college student. I was trying to get good grades and have a social life at the same time while doing extracurriculars. So I didn't really think much of it. And then I started feeling worse. So I was nauseous all the time. I was super fatigued. I would come home from a class and I would take like a 4-hour nap. I fell asleep during class, which is super unlike me. I passed out at an intramural softball game. So just a lot of weird things started happening. I started getting these little red dots on my body, and I'll tell you a bit more about those in a second. But everything kind of pointed me to, something's wrong. I should probably go see a doctor. And I never would have thought that it would have gone to the point that it did. I just thought, I don't know, maybe I have prediabetes, maybe I've eaten too much sugar, maybe, I've got some weird hormone thing, who knows? But I saw a doctor, and she did a CBC, a complete blood count. So this is a blood test that you get done routinely at the doctor's. It's usually the first sign that something is wrong for a bone marrow or blood cancer. So I've included a picture. There's reference ranges. There are no units attached, of course, but you can basically see what my results were on, this is May 22nd, 2017. You can see that every single one of them is wrong. So this is the point where I had no idea what was going on. I was just like, okay, I guess I don't have neutrophils, whatever those are. But I learned quickly that this is not normal, of course. The little red dots that I told you about, those are called petechiae. they're a sign that you have low platelets. Your platelets clot your blood when you get a cut. And so these were little micro bruises that happened at the capillaries. And I included a picture of a child who has them on their face. But you can see 17, that's quite low. And so I started getting these all over my body. And then the fatigue, that comes back to my red blood cells and my hemoglobin. Again, that's quite low. Hemoglobin for a woman about my age is usually between 12 and 13. And then lastly, my neutrophils. These are the three main things that we look at when we're talking about a blood cancer or blood disease. So my neutrophils were really low. That means I couldn't really fight off infection very well. And so I started doing something called the neutropenic diet or neutropenic precautions. And that involved wearing a mask all the way back in 2017. So this is me wearing a mask in 2017. So when you get blood counts like that that are concerning, the first thing they're going to do is assume that it's something to do with your bone marrow, because your bone marrow makes all your blood. And so what they did for me is they sent me to a hematologist to do what's called a bone marrow biopsy. This is where they insert a needle into the iliac crest of your hip bone. It's very similar to what you guys might talk about when you're discussing like a marrow donation with a donor, and I'll talk about some of those differences in a second because it's very different when you're a patient. But one quick tip is if people don't know where the iliac crest is, this is how I tell donors about it. If you stand with your hands on your hips in a superhero pose, where your thumb lands on your back pelvic bone there, that's the iliac crest. And so they go in with a needle and syringe and then extract liquid marrow. That's called an aspiration. And then the other thing they do when you're a patient is they take an actual core of your bone marrow. So if you guys have ever seen like those big fancy wheels of cheese and they're taking a sample, they'll like dig in and they'll take a sample. And that's something they do with your bone as well. So they can see the cellularity from your hard bone all the way down into your spongy bone. I've included a picture of what the site looked like afterwards. It's quite small. I did feel it quite a bit. One of the main differences between a donor donation of marrow and a patient biopsy is that patients are often awake. So our donors do get general anesthesia. This is going to be very different for them. They also don't get that core of the bone taken out. So make sure you're not scaring our donors with that. And this is what my bone marrow looks like. So, like I said, the core of the bone marrow is that thing right there, and then that is the liquid marrow. And they send this off for testing, and the first thing that they learned is that I had something called hypoplastic marrow. So in our marrow, we have different cellularities. This is one reason why we prefer younger donors, because as we age, our cellularity decreases. So our cellularity is basically the percentage of these hematopoietic stem cells that produce our blood versus the percentage of yellow marrow, which is basically just fat cells. And they do have a role as well in making cartilage and things like that. But your cellularity is important to the quantity of the blood that you'll be producing. So hypoplastic basically means that most of the bone marrow I had was not hematopoietic stem cells, it was yellow marrow, which makes sense because you could see that in my blood. You could see that I didn't have a lot of blood cells. So there weren't a lot of cells to test, so I was given a diagnosis of severe aplastic anemia. This is not the anemia that you typically hear about where you just got to eat some steak and you'll get your hemoglobin back up and you'll be okay. This is the kind of severe aplastic anemia where you're just not producing cells. Okay. It's also a bone marrow failure disorder. So my hematologist, this was just at a general cancer clinic. He was like, you know, that's a rare disease. I don't know anything about it, so I'm going to send you to the Mayo Clinic. So I went to the Mayo. I got a specialist in hematology who was also a specialist in transplant. And this is me joking here, giving a sacrifice of mayonnaise to the Mayo gods, William James Mayo, one of the founders, asking him to help me. And the first treatment that I was given is called ATG. That stands for anti-thymocyte globulin. It is basically antibodies from a horse. So they provide horses with human antigens, and the horse will then produce an immune response, humoral antibodies so that they infuse those into you, and it should dampen your immune response. The idea is that, as far as I understand, severe aplastic anemia can be almost autoimmune in nature, where your own immune cells attack your bone marrow hematopoietic stem cells. So in order to provide me that treatment, they had to give me something called a PICC line. That is a peripherally inserted central catheter. It went to my arm and then down into my chest above my heart. And I haven't provided a x-ray, although it might be very hard to see the line. It starts there and then goes this way over my clavicle. Okay. And because I had low platelets, this was something that took a while to heal. This picture, this is not what it should look like after you get one of these if you're healthy, but I didn't have platelets, so it bruised a lot. That treatment, I was in the hospital for 5 days, getting those infusions of those horse antibodies. And then after that, it was kind of a watch and wait period. So there's maintenance that had to happen. Like I said, I wasn't producing those red blood cells or platelets. And so I had to get a lot of transfusions. I had to get a lot of platelet and red blood transfusions just to be able to survive in the meantime while we waited for that treatment to work. They don't like to give you a lot, because if you move forward to a transplant, those extra, when you get a transfusion, these blood products are from other humans, other individuals with their own immune systems. And so there's some interference that can happen. So basically, they kept me real low for a long time. I would only get a bag of red blood cells when my hemoglobin was less than 8 grams per deciliter. Like I told you earlier, 12 to 13 is normal for somebody my age. So it was a little over half, but that meant I was fatigued pretty much all the time. And then for platelets, they actually let you get really low on these unless you're going to go in for like a surgery or something. They would only give them to me when I was less than 10 million per liter, and reference normal is like 150 to 350 million per liter. So I was kept pretty low, just maintenance. It was just to live. It was not to, for the most part, it was not to have a quality of life. It was just to get through. This meant that I had to be carried upstairs because I couldn't do it. I couldn't walk upstairs myself. And I also had to be really careful about not getting cuts, because with these transfusions, these blood products don't last very long in your system. The red blood maybe a week, platelets a couple of days. So had to be very careful. And in this watch and wait period, I went back to school. So I really did not like waiting around and not making steps towards my future. I think a lot of you can identify with that. So I went back to school, but on a reduced schedule. I basically worked on my capstone, and I did TA for a class because I really wanted to. So I worked on my capstone project, basically for my degree, biomedical engineering. It's a two-semester, one-year project. It's really intense. And I got through the first semester. So we got to do our poster presentation. That is the binder that we submitted at the end of the semester with all the work that we did towards our project. And this is when I started volunteering for Be the Match. So I always am pretty upset about the fact that I didn't know about this wonderful organization until it affected me personally, which is why I try to tell my story as much as possible, because people deserve to know that there is something life-saving out there. And I just didn't know. I was also on a lot of medications, so because I didn't have those neutrophils, the immune response that a normal individual would have, I had to be on prophylactic medication, so antivirals. In Arizona, we get valley fever, so antifungals. Those ones really taste bad. Lots of different medications. I was on like 20 different medications at the time. And so I had to have a schedule because no one's used to taking 0 medications to 20. So that's the schedule right there. And I was still working on my degree while getting blood transfusions and stuff. That was between June 2017 when I got that ATG treatment all the way to December 2017. And then in December 2017 is when we finally decided this isn't working. I had regular blood tests. They never improved. We just kept watching my numbers decrease and decrease and decrease, and me dependent on these blood transfusions from amazing blood donors. So we knew that the next step was going to be a transplant. At this point, I did know that I had a donor ready to go. When you're a patient, they let you know what the situation is so that you have, you know, hey, I'm going to move forward potentially, and at least there's somebody there who's willing to help. So I knew for a few months at that point that I had a donor in Poland, 30-year-old male. That's all I knew. And I knew that he was willing to save my life as well. When you get ready for a transplant, they do more testing on you. They want to make sure a few things. First, you're sufficiently sick enough to warrant something like this because they're not fun. They don't do transplants for people just for fun. They do them because they're necessary and they're life-saving. And then second, that I'm healthy enough to get through this successfully. Doesn't guarantee that every single person will survive a transplant. It's tough to understand. It's not guaranteed, but they do the testing so they understand where your other organs are at. And it does involve another bone marrow biopsy to look at the status of your cells. For people with leukemias, they're going to be looking at, you know, the blast percentage and, you know, just how dense the bone marrow is. So I had hypoplastic. I didn't have a lot. If you have something like a leukemia, you're going to have hyperplastic, where there's just a ton of cells overgrowing and going crazy. This time around, they found something interesting. So first, I still had hypocellular marrow. I had less than 5% cellularity. If a good rule of thumb for how much cellularity you should have at your age is 100 minus your age. So I was around 21. I should have had 70 to 80%. I had less than 5%. The interesting thing that they found, though, is this time they got enough cells to do genetic testing. And they found something called Q7 deletion, or monosomy 7. It basically means my 7th chromosome in my hematopoietic stem cells was missing a copy. This is now cancer. It's still also called bone marrow failure, but it's also considered a cancer. And I was high risk as well. High risk for MDS, myelodysplastic syndrome, my new diagnosis, means that there's a decent chance this progresses to AML, acute myelogenous leukemia. And so I provided a diagram of hematopoiesis, basically how you start with these hematopoietic stem cells and the lineage all the way down to the blood cells that we find in our peripheral blood. And so we start with our hematopoietic stem cell, then we have a common myeloid progenitor and lymphoid. And then under the myeloid progenitor, you get megakaryocytes that produce thrombocytes. Those are platelets. And then you have erythrocytes. Those are your red blood cells. And then from the myeloblasts, you get certain types of granulocytes. These are immune cells. The one that I told you about, that's the most important, is your neutrophil count. And so you can see from this diagnosis where those blood numbers came from, because I had low platelet, red blood cell, and neutrophils. Makes sense because it came from the myeloid progenitor. The other thing is that for the diagnosis that I got, myelodysplastic syndrome, less than 0.2% of the people who are diagnosed with this are under the age of 40. So every single person I talk to is really old. Okay, so that happened in December. A month later, January, is when the transplant was going to happen. They put you through a week of testing. They test your lungs. They make you breathe into this thing 1,000,000 times, and then they yell at you because you do it wrong, because you can't breathe enough, because you don't have enough hemoglobin, and then you do it all over again. That's just one of the tests. There's also the EKGs, and just, it was constant. But I was admitted for my transplant on January 17, 2018. And the way that they count these numbers down, or the day that you're going to have your transplant, is pretty interesting. So your admit day, at least for me, was day -8. And day 0 is your transplant. And so it's hard to see, but this is my transplant schedule. Basically, I was given, so I was admitted on day -8. I was provided, this time they took out my PICC line in my arm and they put in a Hickman line in my chest. Same thing, but this time it had 3 catheters instead of 2. I called them my tentacles. And then that one is actually sutured onto your skin, which is real fun. They also cover it in this tape, and you only get to, you can't really shower very easily with it, and you have to get the tape removed, clean the area, and put the tape back on once a week. My skin didn't really like it, so you can kind of see like how irritated it was. So day -8, I got my Hickman line. Day 7, day 6, day 5, day 4, I was given a chemotherapy called busulfan. And then day 3 and 2, I was given another chemotherapy called Cytoxan. And the goal of chemotherapy for a bone marrow transplant is to eradicate everything in your bone marrow. They go scorched earth approach. They don't want anything left. So that when your new bone marrow comes in, it's empty, the home is ready, and you have less chance of having those cancer cells. Mine was a little different. Like I said, I didn't have a lot of cells in there to begin with. A lot of people, before they even get a transplant, have to go through, it's called, I'm forgetting the word, but there's a type of chemo that you do beforehand in order to reduce those stem cells, and then they go scorched earth approach. So I was lucky this was my first type of chemo, aside from some oral chemos that I had before. Then I had a rest day, and I had my transplant. I'll tell you more about the transplant in a second. After that, I had some other types of chemotherapy kind of interspersed, and then since day 0, your numbers are now on the positive end, so day 1, day 2, day 3. That was one of the bags of chemo that I had, and this is a picture of me before the chemo hit me like a truck. So I was pretty alert for a while, and then it hit. It's hard to see, but you can kind of see just how bloody the Hickman line was when they put it in. Like I said, still didn't have platelets, so it was pretty bloody. And then this is a picture of when we finally decided to shave my hair. I did it a little early. Sometimes people wait until the hair starts falling out. Oh, that was what I forgot. I dyed my hair purple before I got my transplant, because that's the best time to dye your hair a crazy color. So I didn't feel like waiting, because I knew it was going to happen. And when you're in the hospital, you are hooked up to this pole the whole time. They don't take it off, not for showers, not for anything. So it was really hard to wash hair that was really long. So I was just done with it. And I thought I was done with it. See, I'm smiling here, and then I wasn't smiling 30 seconds later. And then my transplant happened. And like I said, I didn't know anything about my donor except for 30, male, Poland, willing to help me. This was the actual bag of cells that he provided me. He donated through PBSC. When my diagnosis with aplastic anemia, they requested marrow first. And then when the diagnosis changed, they changed it to PBSC. And he was willing to do both. He had no issues with any of it. This was a cake I was given, my day 0, my rebirth day is what they call it. I didn't eat the cake, I was too nauseous, but I posed with it. And then the other thing that they do before they give you these cells, and all they do to give you these cells, it's not a surgery, it's not anything crazy, they basically just hook the cells into that line in my chest, and then it just transfuse over the course of a few hours. So it's actually pretty uneventful. As far as life-changing days go, they do provide you with a hefty dose, 50 milligrams of Benadryl straight into your Hickman line. It gives you a head rush, and then you're knocked out. But I knew how important that day was. It was not lost on me. I don't think it's lost on anybody. And even though I was really, really fatigued and I could hardly keep my eyes open, I tried really hard to at least look at the cells through the line. It's really, you can't really see them here. I might have a better video that I could show some people if you care, of these cells moving through the line, and you can see them in like they're clumps up. You wouldn't be able to see them individually, but they kind of clump together, and so you can see some of these cells as they're moving through my body. And then right after that picture, I fell asleep. And my rebirth day is January 25th, 2018. After that, I was in the hospital for, I think I got out 3 weeks later. That's not normal. I pretty much begged my nurses to let me go as soon as possible. Like I said, I really don't like being cooped up. I don't like having to stop the things I want to do. So I was like, just get me home. 3 weeks is not normal, like I said. I've known a lot of people who were in there for minimum a month, sometimes 6 months, sometimes more. And this is just depending on how your body does. I was very lucky, so I didn't have complications that kept me in the hospital in the way that some of my friends have dealt with. The first 100 days are extremely important. It's kind of the metric that they use. Even when I was out of the hospital, I had to go back to they call it the clinic. It's on the 7th floor, it's special, and they make you stay there. And basically, I went back every single day until they could watch my numbers and take my blood for testing, weigh me, every test that they could think of to poke me, they did. And you go back every single day in the beginning, and then as you slightly improve, they're like, okay, we'll let you stay home 1 day a week. Okay, now it's 2 days. Okay, now you can come every other day. And now it's once a week, or whatever it is. And so you slowly get to start having more independence. And that 100 days is really important, because that's kind of where the acute stage is over, for the most part. They watch you very closely in that first 100 days. My 100 day was on Cinco de Mayo. Okay. But I included some graphs because I'm a numbers person. I like seeing numbers, and I was hoping somebody else in there would care too. But this is, those 3 numbers that I told you about that are super important, the neutrophils, hemoglobin, platelet. The red is before transplant. The little upticks that you see, those are blood transfusions. I got like 2 bags or 3 bags or something with that data point. And then the blue after that, that's my transplant. You can actually watch my numbers improve as the cells found their home and started making my blood. The other thing that happened in the first 100 days for me was something called graft versus host disease. This is where your new immune system is too strong and it starts attacking your own body. I was very fortunate, mine was not that bad. I had it in my stomach, which meant that I was puking constantly. Couldn't keep any food down. But as soon as we figured it out, I went on some steroids and it solved pretty quickly. I was on them for a long time because better to be careful than not. But I've known people who've had really bad graft versus host disease where it affects major organs like their kidneys or liver. And it could mean being on immunosuppressants for the rest of their life. It could mean requiring things like dialysis. So I was really lucky. And I gained strength. It takes a long time. The chemo is really hard. It's me and my sister. I loved this graph too. I found this randomly one day while looking just through my phone because I was bored. This is my steps over the course of 2018. I had my transplant mid-January, so you can see I was a little active in January. And then February, I was not at all. And then over time, I pretty much linearly gained strength. I got to be with my niece. I get to watch her grow up. And these are some of the friends that I have made because of this journey. One thing that Mayo Clinic has that a lot of hospitals don't is actual support for people my age. Cancer doesn't happen a lot in young people. When you're a child, of course, we want you to have that support, and there's a lot of programs for children. There's a lot of programs for older people because cancer tends to hit the older population a lot, as you all are aware. But young adults are often forgotten about. And so Mayo Clinic started a program called Yeah Me Too, Young Adult Cancer Support Group. And I've met a lot of amazing people. And then I got to go back to school. I went back as soon as I could, probably sooner than I should have, because I still struggled a lot. I couldn't really keep up with my peers, even though they expected me to. Like I said, I was a junior when I got sick. By the time I went back, all my friends had graduated, and I was with a new group of students. And so they didn't quite understand. They weren't there for the beginning part. It was a little tough, but I did it. I graduated. Finished my capstone. I hated it. Never want to do that again. Thank God I don't have to. And then this is when I started doing more with Be the Match. So I did regular recruitment where I'd go to drives and I'd talk to people one-on-one. But then I started telling my story to bigger classes because I took this class on cancer. And I'm sitting in this class of 400 young adults, preferred on the registry, and I'm realizing these people all care about cancer, and I bet almost none of them know about this registry. So I shared my story with them. At that point, I didn't know, if anybody joined the registry, but a few months later, people recognized me and told me that they did, and then they got their friends to join, and I realized this is really important, so I started doing that more. I focused on science classes because it's my comfort zone, as well as I feel like people in the medical field or in sciences will have a basic understanding of some of the things that we're talking about and might identify a little stronger. Of course, we started branching out too, but I started with science. And then this is my hematologist, Dr. Lisa Sprout. So she's a very important person to me. Then I had my 1-year anniversary. It's a big deal. I was 1 year old. We had a party. I got a tattoo. We had cupcakes. And this is who saved my life. So people, I'm sure, ask you, will I ever get to know who this person is? It's not guaranteed. If you're patient, if donor and patient, let me back up. It's hard when I'm not on the registry. So if you're talking to a donor in the US and they want to know if they'll ever meet their patient, if the patient is in the US, you have to wait a year before you can both agree to exchange contact information. Not everyone wants to meet the person, and so sometimes that doesn't happen. But sometimes it does. If you're in separate countries, I'll just simplify it. If you're in separate countries, some countries have rules against it entirely. You will never get to know who this person is. Mine was in Poland, like I said, so it was 2 years. So I had to wait 2 years to know who he was. I got his contact information right away, but then I paused, and I was like, what do I even say to the person who saved my life? And he actually reached out to me first. Yeah. And I thought that what I'd like to do, first of all, let me introduce him. This is Andre, probably pronouncing his name horribly. He's very Polish. And this is his wife, Justina. They got married not long after he donated to me. His wife was also pregnant when he donated to me. But I thought what I would do is share with you some of the quotes that he wrote in the emails to me. We have emailed back and forth, and like I said, he's very Polish, so this is Google translated, but the meaning is still there. Okay. So I have one quote about him introducing himself, and then the other two are his decision to join the registry and donate. Hey, I am Andre. I am your genetic twin brother. I would love to meet you and find out how your health is. Please write how you feel after the transplant and what the doctors say. I wish you and your family a lot of health. I joined the donor base a few months earlier before the foundation called me. I became a donor because I wanted to help. I was very happy when I found out I had a genetic twin sister. They only told me that you are a young woman from the United States. 2 months before donating the bone marrow, I was very concerned about my health. I even quit cigarettes so that all the tests were good to help you, and I am very happy that you are healthy. I was in the database for several months. I was surprised that they found my sister in need so quickly. I didn't think for a moment. I was happy to help save someone's life. It meant a lot to me. I was eagerly waiting for the information from the foundation, whether the transplant was successful. When I got the information, we were glad that everything went well and that you were alive. So don't thank me. In my place, you would do the same. This is the kind of donor that we want for every single one of our patients. I had the ideal situation. I had a donor for one. Not everybody does. You guys know that. You know there's an ethnic disparity. And my donor was willing, able, excited to help me. I now work for the National Marrow Donor Program for Be the Match. I've gotten to meet some wonderful people who work here. Every single person is so motivated to help people. And I'm very lucky to have the job that I do, and I'll tell you about that job in a second. So I'm a donor operations specialist. I work in donor services. My job is to call the donors that match with our patients and tell them that they get to save a life. So you guys are the first step. You recruit. I'm the next step. I make sure that they're ready to go when the transplant's gonna happen. We call them, as the doctors tell us to. We do something called CT, confirmatory typing, or HR, high resolution, additional testing. Sometimes I call people who joined the registry before I was even born. I've called the guy who was born on my actual birth, or not born, joined the registry on my actual birthday. So sometimes they don't remember, and I have to re-educate them, and I have to get them excited about donation again. I have to let them know why this is so important. I educate them on the marrow and PBSC donation, the potential for travel, the timeline, the time commitment, same thing you guys do, a little more detail. I answer all their questions, make sure that they're interested. Sometimes they're not. Those are hard. Sometimes they don't remember anything about us and they think we're spam, and I've gotten some calls saying, I'm gonna report you to the FBI, and it's crazy. And then once, I kind of answer their questions, I ask them some questions, because we wanna help them get to donation. We will do anything that we can to get this patient the donation that they need. But when and where they join the registry is a big factor on if they move forward to donation. If I have drive information, I can at least remind them, hey, you joined at so-and-so college, and sometimes it sparks their memory enough that they call me back. The donor age and their health concerns also has a big impact on, if they're gonna move forward to donation. Sometimes older patients will have a lot of health conditions, and we'll have to talk about all of those. Donor ethnicity does play a part as well. Sometimes we have people call in because we've been calling them and they're very concerned, don't know who we are. Sometimes I have to have the tough conversation about ethnic disparity because somebody doesn't want to donate, but I want them to have all the information before they truly make the decision. And sometimes ethnicity plays a part because they don't trust the healthcare system, and that's an entirely different, presentation, conference, all of it. The biggest question that I ask is, how can we help? So I try to make sure that they have everything they need. Do you have pets? Do you have kids? Do you need us to put your pets in a pet hotel? Can we help you get a babysitter? Would your job be supportive? Can you take 3 days off to donate? All those things are very important. And there's a lot of things that we can do to help them get through a donation. I also do an extensive health history questionnaire with them. This is for both donor and patient safety. So we have a main one. First part is about donor safety, where we kind of filter and make sure that they don't have any health conditions that would be unsafe for them to move forward. And then also patient safety. So the second half of the questionnaire is about communicable disease risks to the patient. So if we're gonna take these cells from you, what kind of risk is there? And we're very different from blood. I know you guys know that. So even if somebody has a risk, we'll still take you. We just got to know what it is. And then the additional testing is a big part. So we either send them cheek swabs or we have them go to a local blood draw appointment. And we're going to be further testing their HLA. With the blood draw, we're also doing IDM, so infectious disease markers. Again, we need to understand if the patient's going to be safe after this donation. We basically prepare them for the next stage called workup. And donation. So I kind of filter, I'm the filter. I'll make sure that we have committed, available donors for when the patient moves forward to a transplant. Not everyone does. I've been working there since March, and I've gotten 200 donors prepared and say yes, and they're healthy and they can move forward. And I think about 15 of them have actually donated. And I build the emotional connection, and I thank them for being committed donors. It's also really nice because I can't talk to my donor over the phone, but every time I talk to a donor and I make sure they're comfortable and ready, it kind of feels like I'm talking to my donor. So that's what I do at Be the Match, and I share my story. But thank you guys so much for listening, for your attention, for all of the work that you've done. You guys are amazing. You're all bright, young people, and I know you're going to do amazing and save lives. So thank you.
Taylor, truly, thank you so much for sharing your story with us and for being vulnerable in front of all of us today. Your story is a global one, reflecting more than just a connection between the USA and Poland, but a universal need for wonderful organizations like Be the Match, kind donors like Andre, and the unsung heroes every day who are working on the ground. The important role Be the Match played in you being here with us today emphasizes our devotion to furthering Be the Match's mission. We are most appreciative that you continue to give back and pursue the important work that Be the Match does. As a token of our appreciation, and on behalf of HOSA, we would like to present you with this gift. Oh, thank you so much. And HOSA is so excited for the opportunity to partner again with Be the Match this year.